Greetings, Black Male Engagement Program. My name is Dr. Joseph B. Richardson, Jr. I'm an assistant professor in the Department of African American Studies at the University of Maryland, College Park, and I'm also the co-director of the Young African American Males in Maryland Violence Intervention Program. This program was started in 1998 by the director of the program, Dr. Cornell Cooper, trauma surgeon at the University of Maryland Medical System's Shock Trauma Center. The aim of our project is to reduce recurrent violent injury among young African American men who are admitted to the trauma unit for injuries such as gunshot wounds, stabbings, and beatings. To date, our program has been highly successful because we have a host of interdisciplinary staff who manage to provide psychosocial services as well as other social support services for young men who have been injured, who have been admitted to the trauma unit. Our program approaches people at bedside to offer them comfort and assistance, because at that trying time when a young man is sitting in a hospital bed, it's often a window of opportunity for that young brother to reflect on his life and think about how he can change his life, and also about what got him there and how our program, in effect, could use that opportunity to make significant changes so that person doesn't return to the trauma unit. Unfortunately, 30 to 60% of the young African American men that we encounter have been hospitalized 2 or more times for a violent injury. So we've seen a cycle of violence with young men coming in and out of the trauma unit within days after they've been released, or months, or within years. Statistically, 60% of young men who have been admitted to the trauma unit will be readmitted within a 5-year period, and 20% of those young brothers will die. As part of our initiative, we aim to reduce recurrent violent injury among young African American men in Baltimore by providing a host of psychosocial services as well as a wealth of support services throughout Baltimore, which we utilize through referrals as well as through the caseworkers and outreach workers that work with our program. Currently, we work with the juvenile justice system, we work with housing assistance programs, employment assistance programs, GED programs, as well as the Department of Probation and Parole, where we have a senior parole and probation agent who works with the population of young men in our program to reduce criminal recidivism as well. At least 90% of the brothers that we work with who come in the trauma unit for an injury have a history of incarceration of 6 months or more, so there is an intersection between violent injury and incarceration. So our job is to try to save lives as well as reduce the number of young brothers going into the criminal justice system. Hopefully, the Black Male Engagement Program will find value in what we're doing. The history of our program has been well acknowledged. Dr. Cooper in 2009 was the CNN Hero of the Year award, and also in 2010 an article was published on him in the New York Times entitled "Breaking the Cycle of Violence." As far as for me, I have over 14 years of working with young brothers on violence prevention programs, as well as working in jails in the Maryland, D.C. metropolitan area. Again, I hope that you guys find our proposal of value and something that you're willing to support, because in the long run, what we're doing has saved hundreds of lives of young black men who may ultimately be dead if we didn't intervene. Thank you.